Okay, good morning everyone. So today we are going to discuss a very highly important topics, both your university exams and obviously NEET PG. So what is the name of topics? The name of topic is what is the difference between the incidence and the prevalence. So we start the difference with the definition. So, what is the definition of incidence? Incidence means the total number of new cases, point to be focused, the total number of new cases in a defined population, total number of new cases in a defined population during a specific period of time or during the specific duration of the time. So, during a specific duration of times, how many total number of new cases comes in a population, it is called incidence. Incidence is not affected by the duration of illness or if any patient recover during the study or the death of the death of the patient is occurred during the study. So these all three parameter, I mean the duration of the illness, if patient recover during the study or the death of the patient occur, these all things not affected the incidence. While in case of the prevalence, these all three things indirectly or directly affect the prevalence. So what is the definition of the prevalence? The prevalence means total number of cases old plus new at a in a defined population during a fixed duration of time. So in case of the prevalence, we take or calculates the total number of cases, I mean old and new cases during a fixed duration of the times. Basically it is the definition of the period prevalence, not point prevalence. For point prevalence, it is the point of times the total number of old and new cases. So here one point we try to focus. In case of the incidence not depends on the duration of illness and number of death occur during the study or the number of patients who get recovered during the study periods. But these all things in case of the prevalence, they directly or indirectly affected. We see how this case is directly or indirectly affected. So we start with the definition. In definition we can see that I write that total number of new cases occurring in a defined population in a specific duration of time irrespective of the death recovery of the patient during the study, or it is not affected by the death or recovery of the patient and the duration of illness. Okay, in case of the prevalence, it is the total number of old and the new cases in a defined population in a specific duration of the time, and it directly or indirectly depends on the number of death and the recovery of the patient, and directly depend on the duration of illness. So now we are going to discuss how this prevalence is directly or indirectly depend on the number of death and the recovery of the patient. So first we try to listen. Prevalence, what is the formula of prevalence? The formula of the prevalence is incidence into the duration of illness. So let's think. If the number of death due to the any disease will more, if the number of death due to the any disease is more, it indicates that the disease are very fatal. So if the number of death due to the any disease is more, the duration of illness of a person is low. Obviously if number of death is more, that means patient is suffer from the less duration, because within the less duration they fly on. So obviously if the and in formula you can see that the incidence depend upon the duration of illness. So due to the more number of illness, it indicates that the duration of illness is low, and if the duration of illness is low, that means the prevalence is low. If the duration of illness is low, then the prevalence is low. So this is indirectly depending of prevalence on number of death. What are the other factor? The other factor is the recovery phases. So if any disease, the recovery phases is more. So if any disease, the recovery phases is more, it also indirectly suggests that the patient duration of illness is low. If a patient having a very high duration of illness, then definitely his recovery rate is low. So if any study suggests that yes, in this is the recovery phase is higher, then indirectly it tells that the duration of illness is more. Duration of illness is less. So again, if the duration of illness is less, the prevalence is less. So here we point to focus on two things. If any factor indirect, basically these two factors, number of death and the recovery, they affect the duration of illness. So due to the impact on duration of illness, they affect the prevalence. So these are the indirect parameter which affect the prevalence of a disease. The third direct parameter is the duration of illness. We can see that in formula the prevalence is directly proportional to the duration of illness. So here we try to discuss how this number of death and recovery indirectly depend on the prevalence. But such things are not seen in case of the incidence. Incidence not depends upon the number of death and duration of illness or recovery phases. So one more important point, in case of the incidence, we not count the case if it is begun before the study period. Let's suppose we take the study period of the 1st January to the 31st December. So if any case began before the 1st January, we not count such case in a incidence, but we count such case in the prevalence. In incidence, we only count those cases which is a start during the study periods. After beginning of the case, it is not matter that the patient will die or recover. The incidence not depends on it, but the necessary point is that the disease is a start during the study period. If the disease is begin before the study period, we not count such disease under the incidence condition. Again, we try to explain this with the help of a graphical manner for your better understanding. This is very important topics. Otherwise, in exam, even me get confused. Okay, so ready for the graphical representation of the difference between the incidence and the prevalence. Okay, so let's suppose we take a study duration of the 1 year, and we start the duration of a study from the 1st January 2025 to the 31st December 2025. Okay, so we having a duration of a study. Here we start the duration of a study at the 1st January 2025, and our study period is 31st December 2025. I mean overall 1 year study periods. So in overall 1 year study period, what happens? Some person develop disease before the this 1st January. Let's suppose this is the person A who develop a study before the 1st January, and his disease is progressive even 1 year, and after the 31st December. So this is the first person. Okay. In the second person, their study I mean their illness disease starts after the 1st January and they recover before the 31st December. Okay, this is the person first, this is the person second. In third person, their disease start before the 1st January and they recover before the 31st January. In the third person, disease start again after the 1st January and they recover before the 31st January. This is the fourth person. This is the third person. Fifth person, disease start after the 1st January and they recover after the 31st January. Any person six, this is the fifth, this is the sixth person who this is start after the 31st January and they recover after the 31st December. Okay, one more case we take. Let's suppose this is 6 and this is 7. Here the person disease began before the 1st January and they recover before the 1st January. So this is the 7. Now in question what the examiner asks, they give this chart and we have to calculate how many of these person belongs to the incidence criteria and how many of them belongs to the prevalence criteria. So first we go for the calculation of incidence criteria. Okay, so how many of these 7 peoples belongs to the incidence criteria? Incidence criteria. So what I am already tell to you, definition of incidence, it is the total number of new cases during the study periods. I mean total number of new cases that comes out during this 1st January to 31st December 2025. So we start with one by one and now we try to see that each they place in incidence. One side we write the incidence and another side we write the prevalence. Okay, so we take one by one and according to our knowledge we put this data, either they belongs to the incidence or prevalence. So what about the person first? This person first, the disease is a start before the 1st January and according to the definition of incidence, if any disease start before the study period, we not put under the incidence criteria. So here the study duration is the 1st January to the 31st December. This is the study period. This is the study periods and the person illness is begins before the study period. So if any person illness is begin before the study period, we not put such person illness under the incidence criteria. But in case of the prevalence, we calculate the total number of old and new cases that began before this data. I mean before the study period in the data. So this person, first person, their study is obviously began before the 31st December. So we put this first person data under the prevalence criteria. What about the second person? The second person, their illness begins during the study period. I mean their illness begins during the study periods. So we put his data under the incidence. What about the third person? The third person again, their illness began before this study period duration. So whenever any person disease began before the study period duration, we not put such data under the incidence, but we put data under the prevalence. So we put this 1, 2 and 3 data under the prevalence. What about the fourth? Their disease began after the study period or the duration of a study period. So basically we put 4 data under the incidence criteria. Fifth fifth data, their study, their disease again began during the study period. So we put data here, and 4, 5. Now what about 6? Let's say this 6 data, the 6% disease illness, they begin after the disease period. After the duration of a disease. So if any person their disease is appear or begin after the duration of a study periods, we can put such data under neither prevalence nor incidence. Okay, so this 6% data are not considered as neither prevalence nor incidence. So what about the 7th? The 7% again, his data are not put under the incidence because their disease of illness is begin before the study periods, but their data are put under the prevalence. So these are the data we have categorized the patient according to its incidence and prevalence. I hope you understand the difference between the incidence and prevalence. Okay, see you in next video.